Good evening, dear viewers, and good evening, Dr. Fatma.
Hello, Abdullah. Good evening, and good evening, our dear audience, and welcome to another new episode of Medical Talk, the program that brings you trusted medical knowledge to help you and your family live healthier and better lives for more confidence.
Dear viewers, in recent years, aesthetic medicine has evolved rapidly, offering advanced techniques that promise natural results, minimal downtime, and safer procedures than ever before.
Definitely, Abdullah. But with this rapid growth, there's a lot of confusion in this field, and there's a lot of trending procedures on social media and misinformation also, with fillers and facelifts and new technologies like a lot of the anti-aging technologies. So we need to clarify a lot of this in this episode.
True, Dr. Fatma. Also, many people today are influenced by trends without fully understanding what is safe, what is effective, and what could actually cause harm.
Definitely, Abdullah. So to guide us through today's episode, it's very important about aesthetic medicines to be discussed and clarified. So we're welcoming with you today Dr. Imad Alnajjadah, Senior Consultant Plastic and Reconstructive Surgeon.
Stay with us. I'm Abdullah Al-Ajmi.
And I'm Dr. Fatma Al-Ansari, and you are watching Medical Talk.
Hello, dear viewers, and welcome back to another episode of Medical Talk, the program where you get your trusted medical knowledge from. Today we have with us Dr. Imad Alnajjadah, Senior Consultant in Plastic Surgery. Thank you so much for being with us today, Dr. Imad.
Thank you very much for inviting me for this talk.
Nice to have you with us, Dr. Imad,
Thank you.
today.
So today we're going to talk about, Doctor, is beauty and aesthetic in medicine. So for our first question, what do you believe 5 things that we should leave behind in 2026 regarding beauty and aesthetic medicine?
First of all, we say for the young doctor, overfill is overdone. Don't try to make this thing it is invisible to become visible. If you do it and you fill it more, especially in the face or in the body, you became beyond the standard of the aesthetic shape, it will become ugly. This is the first things. Second things, no one surgery fit for all surgery. What does that mean? Not all the one who need facelift, you have to do deep lane facelift. Not all the one who need the rhinoplasty, you have to do it for them preserving rhinoplasty. Not all the patient who need the body contouring, you have to do rib contouring. You have customized the patient according to the case. And other things, if the patient asks you to do something of the surgery and you cannot make it, and you believe it is not, the patient is not realistic, or she had psychological issue, you have to tell her, sorry, I think you have to see another doctor who can provide you for this, or you can say no. This is the second point. The third point, device sold surgery. This is not true. This era should be stopped. No device can replace facelift. No device can replace rhinoplasty. No device it can it can help in a certain amount, but doesn't replace the surgery. Other things, don't let your ego is over the ethics. Usually you have to put the medical ethics, and you have to keep the standard of the treatment which is recommended from the authority, and don't try to push your ego to do something beyond that. And this is the most important device, I think, for the young colleague. And other things, I think, don't let the social media drive the surgery. Usually the social media, whatever you see, and sometimes it's vague. We call them Kardashian syndrome. It is not true. Maybe it is there is a Photoshop, what we are saying, and that's why the social media sometimes drive you for certain surgery, but this type of surgery doesn't fit for you.
Because in social media, there's other stuff like filters, maybe Photoshop. So nothing we see online, we should imitate or do the same.
That's right.
And also,
This is, I think, this is the most 5 things, you know, that you have for a young plastic surgeon. They have to admit in this way.
Doctor, not always more is better. Like you said, some people need to stop at a certain point. That's what you said.
That's right. That's right. That's right. And this is the most important. You know, see, our patient usually they have who sick for the plastic surgery and they had one surgery and another surgery. Usually there is a psychological issue in this case, and you have to study the cases before you start to do the surgery.
So Dr. Imad, as a board certified surgeon, what are, let's say, 5 habits that you practice to maintain your professional excellence and patient safety?
First of all, always try to do the right things, as we said in the first part. Usually try to see what is fit for the patient and what is bring this and the safety, plus customize your surgery according to each patient. And as well, as we said before, learn how you say no when you cannot provide the wishes what you need from the patient for kind of surgery, and you find it is out of the standard. Okay, this is one. Second, never leave the OR unless you have the best you done from your ability, because it doesn't matter the time you spend inside the theater. It is, and I know it is important, but you have to do all your best and all your expert to get the best result during the OR. Second things, focus to become expert. You can do all kind of surgery, but you have to be expert in certain things. You cannot do face and body and breast. You have to be expert. The patient usually they are looking for the expert guy, not the one who doing everything. When you become expert and as you try to learn from the who previous, this is give you really in the community you became figure. This is one. Other things, learn one thing every day. What's that mean? You have to continue learning, even if you find yourself you reach the level of a specialized or consultant. Doesn't mean there is every day there is a new things you have to learn. What I do it before 5 years different what I'm doing now. There is a new technology coming, there is a new scales coming, new surgery, a new machine. That's why you have accommodate yourself whatever the new, and you doesn't mean you have to use all what is no, but this is certain scale is improve your outcome for the patient is very important. Other things, try to what I can say, giving back matter. When you let the making learning for teach the others, teach your juniors, the student, even the young plastic surgeon, and try as much you can to let them reach the level to become better than you.
Yeah.
I know it is hard to somebody
pass
with
on
his
that
ego.
experience, yes.
He wanted the others to become better than him, but
Yeah.
this is, of course, it is very good, and it will reflect for from you from inside. It is, you know, you make something.
Yes.
And as well, try to do something, help the others, like to go in a foundation, in workshop, charity, to help, especially if they need special scale from you. I think you have, in this moment, you'll be very good.
Absolutely.
I think this is the 5 point. If you do them, I think you'll achieve your aim and you became expert in a short time. As well, You have to learn from the mistake of the expert.
Yes.
And this is the mistakes is make you avoiding, first of all, to go in the same mistake. The second thing is you know how to manage the complication.
Thank you, doctor. Those are excellent practice strategies and techniques. Thank you for that.
Yeah, Dr. Imad, like you said, it's wise. A person is never satisfied with what knowledge they have. They always should try to learn new stuff, especially with now the world we live in. Every day there's a new things, which take me to my next question, Doctor. There's new technologies now in aesthetic medicine regarding beauty and all of that. What do you think about the new technologies being implemented in the current medicine?
Actually, many things just came in the market regarding technology, especially it's from the machine, regard machine for laser machine, ultrasonic machine, machine which is generate heat, whatever it is came from laser, from ultrasound. This is for skin tightening. As well, you have a part of also regenerative medicine. There is a lot of materials coming in the market to enhance the quality of the skin, improve the laxity, and remove the pigmentation. This is especially for us. And as well, there is a lot of equipment now in the market to improve how to get the exosome, to get the stem cell, to get the BRB. And this is, I think, we are, the regenerative medicine has became really something, the patient like it, and the result is also satisfactory.
So, Dr. Imad, we're talking about recent technologies. What do you think about exosome and the new stem cell procedures regarding aesthetic and medicine?
We have three things we have to understand. We have something they call stem cell. We have something they call BRB, which is plasma-rich platelets, and we have the stem cell.
Yeah.
Now, the exosome, it is biological messenger system. What does that mean? It is nanovesicles released from the cell to give a signal to another cell to enhance the collagen, increase the fibroblast, increase the elastin, and anti-inflammatory. This is the exosome. We can take it either to become, we take it from the synthetics like from plant, or from either human being. From the human being, we can take it from the blood, you can take it from the skin. We take, we call it micrograft behind the ear, 2 millimeter, and you can really make it to the exosome. You do it with the centrifugation, with a certain time and a certain speed, then after that you get the exosome. And this is the exosome like signal. Now the BRB, it is another things. The BRB, it releases the growth factor, and this growth factor enhance the agenesis, and this is the agenesis. It will help. Of course, the growth factor, there is many growth factor. Each one is to play one role, but in general also improve the skin quality and elasticity, and improve also the pigmentation.
So, doctor, all of these are mainly used on the skin, right, doctor?
Yeah, each one had the separate kit and the separate way. Now, the stem cells, it is a new things. We started personally in my clinic since 2012. We are the first one in the Middle East started to have a pure stem cells. And this is the stem cell. It is, we call it adipose-derived stem cell. Throughout the process, we put it in centrifugation, and we get something they call it stromal vascular fraction. And from that, we can get macrofat, microfat, nanofat. And this is also, if you need area, you need vascularization, if you need to increase the volume in this area, like you want to fill the fat inside the face, inside the body, inside the breast, you can use, this is the stem cell with our fat with the stem cell. And this is give you volume, give you regeneration, and as well this is a new vascularization, what you call it genogenesis. And we can say it like, you know, it's just somebody willing to drive in the plane. You can take economy, business, first class.
Yeah.
First class is the stem cell. Okay, if you go for the BRB, we can say it as a business. If you go to the exosome, you can say the economy. The other, and the nice things about the exosome, it is available in the shelf. It gives you immediate effect. After 3 to 5 days, you have it.
Or is it a pill?
Huh?
Is it an injection? Or
injection, yeah. You can inject it in the subdermal level, and you give you the effect. You notice it immediately after 3 to 5 days. The BRB, you need at least 1 month. If you talk about the stem cell, you need at least for 6 months to 1 year. And that's why.
Are they truly effective, or are they still in the experimental stage?
No, it is purely effective. That's why we are use them. If you don't, if you use material, the patient is very clever here. If he used some material and he didn't see there is any effect, of course he will not come back. And as well, for you, you cannot put any material unless it is approved FDA.
Yes, true.
So,
Yeah, go ahead.
following up with Abdullah's question, Dr. Imad, how safe are these emergent medical treatments, and how cautious should patients be before trying them?
This is all of them safe.
Yes.
The only things, if you're talking about longevity, how long it will stay, this is the issue. Usually the BRB doesn't stay long. The exosome, it is in the middle. The long effect, you have it from the stem cells. Now, this is but regard the safety and the way you prepare it to get it, this is the safety way. You have to follow certain protocol to get maximum effect from all what you do. Because, you know, there is a people preparing the fat by canting, the other one by centrifusion. That's why you have to follow certain system which is give you the best result from their experience. And other things, you know, the patient itself. Sometimes if the patient had a permanent filler, if they have the recent infection, you cannot use them unless the area is clean. If it is clean, you can use it, and it depends on the condition, for which disease you want to use it. Of course, it is better than any other aesthetic material.
Well, Dr. Imad, it's really an important topic, and I'm sure a lot of our viewers are interested in what you're saying. But dear viewers, we still have more questions for Dr. Imad, but after this short break. Welcome back, dear viewers, to Medical Talk. We're still with Dr. Imad Alnajjadah talking about the different beauty medicine and aesthetic medicine. Dr. Imad, our next question is facelift techniques. So, what are the latest facelift technique? And there is like scarless facelift, and I can see like there's a ponytail facelift and endoscopic facelift. Can you tell us the difference between them?
Yeah, first of all, we have to understand what is the facelift. It's the standard facelift. You know, there's the facelift scar is going to either from the temporal area or the hairline, and they go on the front of the ear and go for the neck, or go in the back of the ear, and sometimes go back in the hairline. Now, scarless, it should be the facelift. It is the hidden scar, and if you do the facelift, nobody can notice there is any stigma of the facelift surgery. No scar here in front, and that's why the people do not notice you did the surgery. That's why when it says scarless, that means there is a scar here. If you want to do the mid face, and we can do the lower face. If you want to add for the neck, we have to do another scar behind the ear. Now this one, it is depend on the age and depend how much the you have sagging in the face and laxity of the face. In the past, we can say the scarless for the people from until the age of 40, but now we can see after using the drugs like became like Ozempic face, you have severe laxity, you can do it even early. Okay. Now, the ponytail is the same. It can be scar here and scar behind the ear, or sometime you can say ponytail facelift when you do the scar in the front. Okay. Endoscopic, all of them, the scarless, you have to do them through the endoscope, from the scar from there, from the side of the hair, and you go with the endoscope, release all the smash layer, and sometimes you can approach it to go deep, to do what we call nowadays deep plane facelift. Usually the deep plane facelift, you have to do it through the scar here, and then you go to the mobile area of the smash. This is what we call it the fixed area in the front of the parotid area. And from here to there, it is the mobile. We release the ligament and we advance it. Nowadays, even, which is difficult, we do them through the endoscope. We release everything, we advance this area, we release the ligament, we advance this area. What that means, no dissection on the skin, on the smash. We go above the muscle, release the ligament, drop the nerve, and pull everything without any scar there. But it depends also how much laxity of the skin you have. Okay, this is the question you ask. Scarless facelift, this means scar here and behind the ear.
It's really fascinating what medicine can do. Actually, I was surprised that you can't even see the scars nowadays, which is amazing for me, actually.
Yeah, this is neat, and as well, it is endoscopic, it needs a scale. You need to have to be trained on it. Definitely. And you have to know where you do your plane, especially if you combine with the deep plane facelift, which is the trend now. The deep plane facelift, we do them, you know, because my mentor is Brian Mendelsohn in Australia. He was the first one who did it. And since 1990, I'm doing this this technique, but it is majority of the plastic surgeon don't like to go that way because they have a chance to injure the nerves. And that's why many of the surgeons, they go either for glycation, high smash lift, and that's all.
Fascinating.
Wonderful, Dr. Imad. Dr. Imad, so I'm sure you know many worry about the permanent fillers. Can you tell us which or what is the safest method to remove them, if needed, if there's complications?
I think if you combine remove the permanent filler, also it depends on the area. You have to do MRI to see in which compartment. You know, on the face we have the 2 layers of the fat, and each layer they had the 5 compartments. Then you have to locate it by the MRI. After that, you go either you do from the facelift scar, or you go from the buccal area. It depends on the location. If it is inside the buccal here in the cheeks, you can go from inside without any scar. But otherwise, you can use it from any small scar here, small scar up. You can do the surgery. It depends also as well. It is if it is the permanent filler is inflamed or not inflamed. If the inflamed, your aim to release the abscess and remove the abscess, and after everything is settled, maybe you go again and you remove the rest of the filler with the facelift.
Dr. Imad, a lot of people believe that non-permanent fillers are completely safe. What do you think about that?
No, you know, in the past, they tell us in the non-permanent filler, like because the non-permanent filler, it is 2 categories. We have or more than one. Either hyaluronic acid, either hydroxyapatite, or either other materials. This is the mainly things we are using them as a non-permanent filler. But we notice now the radius, even when you open the face, we found them still the material is there. We do MRI, still the material is there. That means doesn't, as they said, it is maximum it is 1.5 years. Also for the hyaluronic acid, they said also maximum it will be for 2 years. But still, you see when you do the MRI, still you see them there. And as well, when you do the facelift, sometimes our patient developed edema in lower eyelid and stay for a month or more, because it's still the effect of hyaluronic acid is there. That's why you need, before you do the facelift, if there is any hyaluronic acid, you have to try to inject it with the hyaluronidase to solve all the remaining of the hyaluronic acid, and then you do the facelift. And but it is there, but it is no harm, because you know the hyaluronic acid initiate also what they call it collagen, and sometimes had if the good quality, it is moderate collagen. If it is bad quality, it make you more fibrosis and granuloma.
Well, Dr. Imad, thank you so much for these fascinating answers, and I'm sure all of our viewers are interested in this topic. Thank you so much for taking your time and being with us here today on Medical Talk.
Thank you very much.
Thank you, Dr. Imad, for
Thank you very
being
much.
here.
Thank you.
It's been a pleasure.